Welcome to the 343rd of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at the Korea Advanced Institute of Science and Technology. I'm coming to you live from Daesan, South Korea. Today, I welcome Susan Skutta, founder of the group Young and Severely Affected by COVID. Just a reminder, you can usually catch COVID Calls live on weekdays at 6 p.m. Eastern Time. Just go to the COVID Calls YouTube channel to watch. You can hear COVID Calls anytime, recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. You can also keep up with COVID Calls via Twitter using the handle at US of Disaster or at COVID Calls. Please help spread the word and send suggestions for future guests and future topics. And please feel free to suggest yourself as a future guest. I just want to take a moment here to acknowledge once again the incredibly hard work of Shivani Patel, Bucky Stanton, Hyuna Kyum, and Eleanor Mays, who are working on the daily production of COVID calls, the scheduling of future COVID calls, scheduling all the way through the end of the year at this time and probably beyond, and who are working night and day on the creation of the website for COVID calls, in which all of the calls will reside in audio, video, transcript, and much, much more there. So stay tuned for that. Announcement about a launch date will be coming soon. Thank you. As of today, September 16th, 2021, there are 4,660,309 deaths from COVID-19 globally. That's according to the Johns Hopkins University Coronavirus Resource Center. I've been reading an obituary or a story of advocacy for those impacted by the pandemic, and I'd like to continue that now. These are two obituaries which were featured on the Facebook group Young and Severely Affected by COVID. Leslie Ann Ibarra appeared in the Tribute Archive September 5th, 2021. Leslie Booms Ibarra passed away Saturday, September 11th, 2021, at the age of 31. She was born in Corpus Christi, Texas on September 24th, 1989. After finishing school, she pursued a career in the medical field, obtaining a degree as a medical assistant. She succeeded in all aspects of her job. She held a 10-year career in the medical field at the Children's Center of Corpus Christi. It was her whole life. She loved her job so much and was an asset to the company. Nobody can fill her shoes or live up to her expectations. Her personality was just as daring as her hobbies. She loved cars, racing, motorcycles, being with family, and helping others. Leslie is survived by her husband, Angel Amus Ibarra, and her daughter, Rogue Sky Ibarra. She will be dearly missed by all her family and friends. She was a beautiful soul, and a celebration of her life will keep our hearts and faith forever strong. Gabriella Abigail Hitchcock. This appeared as a GoFundMe post on September 5th, 2021. On May 14th, 2013, the world was graced with the beautiful presence of a 7-pound baby girl named Gabriella Abigail Hitchcock. Over the course of the next 8 years, she will have taught so many about life and love, fighting and laughing, to be humble and to have fun. While she was diagnosed with Rett syndrome early in life, she did not let that control her positive outlook. The giggles she would explode with would make the room stop and join in. Her love for Baby First overruled any sporting event her dad wanted to watch. If tech was on, everything else stopped, and that meant anywhere she was. While Gabby was nonverbal, she showed expression through her beautiful eyes. You knew immediately if she was uncomfortable or unhappy about something, but also that she loved what was going on and what she was surrounded by. She was a daddy's girl and had her mama wrapped around her finger. On September 4th, 2021, Gabby took her last breath here on earth. She has joined her Aunt Jenny in heaven. While this world will never be the same, heaven has no idea what it's in for. Hug your babies a little tighter tonight. Say a prayer for Gabby's mom and dad as they navigate the next chapter of their journey. God bless you, Gabby girl. We love you. Obituary of Gabriella Abigail Hitchcock from GoFundMe. And before that, we heard the obituary from the Tribute Archive of Leslie Ann Ibarra. Okay, I'd like to turn to the conversation for today, and let me introduce my guest, Susan Scutta. Susan Scutta was a cytotechnologist and college instructor before becoming a stay-at-home mom. When her children became independent, she qualified as registered nurse from El Centro Community College in Dallas, Texas, and then obtained her bachelor's degree in nursing from the University of Texas at Arlington. Her nursing career started in mental and psychiatric nursing. Later, she transitioned to medical nursing. Early on in her nursing career, it became evident that providing reliable information and educating patients in language that they could understand was an important part of relieving the anxiety and feelings of disempowerment many experience while hospitalized. Her ultimate goals when working with patients are to reinforce hope and a sense of autonomy and to promote compliance. She is currently working as a RN case manager in utilization review. Susan Scutta, thank you so much for joining me on COVID Calls today.
Hi, Scott. Thank you for having me.
So we just want to stipulate at the beginning, Susan, you're the founder of Young and Severely Affected by COVID, but that doesn't reflect in any way on your employment.
That is correct, Scott. This is a personal and private project that I've undertaken starting, I believe, in May of 2020. And although I work at the Evergreen Health System in the Seattle, Washington area, nothing that I say here relates to my work. I'm not representing my employer, and I have never shared any information about my employer or patients or co-workers, and never intend to do so.
Okay, well, I'm glad that we were able to make that extremely clear. And I also want to remind listeners that you're the founder of Young and Severely Affected by COVID, which many of us have been following along for quite some time now. And we were chatting just a bit before. I think it's along with the work that Alex Goldstein has done with Faces of COVID and many, many others who've been trying to highlight the human impact face by face, name by name, story by story of COVID. I just want to say at the outset, you've done a tremendous service in this pandemic, and I want to thank you for that. And I want to talk about it in great detail, but just to start in that way. And if I could, I'd just like to ask you where you're calling from and what the pandemic situation looks like there today.
Scott, yeah, and thank you for that expression of gratitude. That really means a lot to me. I am currently calling from outside of Seattle, Washington, in the Pacific Northwest.
How are things there right now in terms of the pandemic?
You know, at the moment, I believe we are dealing with, many hospitals in this area are dealing with the highest numbers of COVID cases since the beginning of the pandemic. And it is complicated by the fact that we sit right next to Idaho, which is one of the states with the lowest vaccination rates. So not only are we dealing with local COVID patients, but we are also getting patients being flown in or driven in from across state lines. So hospitals are full to capacity. ICUs are still struggling with a lot of COVID patients. Yes, so it's still pretty intense here.
So you're in Eastern Washington then?
You're no, not, but in Western Washington. So yes, Western Washington, area. So right on the coast.
Okay, so sorry, I was thinking about what you're pointing out about Idaho. So you're actually seeing an Idaho impact all the way across the state of Washington.
It does.
Wow. Okay.
It does.
I wonder if you wouldn't mind sharing a memory from this COVID period, something that really sort of crystallizes what it's been like to live through COVID for you.
Probably the very beginning, where we all were, very nervous. And the first case in the United States that was diagnosed with COVID was in Washington State. And I believe that was in January of 2020. And so there was like a communal anxiety that, it was in the air. I think all expected that it's going to grow. This is not where it starts. And it was indeed soon after that the first patients started being hospitalized all over the Seattle area. And we were really worried. So there was a communal anxiety. That's the best way that I can describe it.
And that period, as you said, is one that you experienced before other people in the United States. And it seems like Washington and Northern California was a preview for everybody else in the U.S. and maybe people weren't paying close enough attention to what you were going through.
I think you are right. And at Evergreen Health, we were very lucky to have an outstanding epidemiologist, Dr. Francis Rideau, and he was very quickly on top of things. And I think it could have been much worse. So there was very prompt action, and but still, the impact was felt.
That's an important detail to note too, that people should remember that before there were statewide orders, it was health center by health center, school by school, restaurant by restaurant. I mean, it was really very individual as to what kinds
Correct.
of protocols, right? Were you ahead of state guidance in the kinds of actions that you all took?
I don't have the specific information about that, and because I'm not representing the health, the green health system, I don't want to talk about that. So possibly, but I don't have that information.
So I wonder if you wouldn't mind talking a little, though, about your background in nursing, and curious to, particularly what you're seeing now. I know you probably have nobody that's alive today has seen a pandemic like this, but how prepared were you in your training or in your background for the kinds of things that you've seen, and how are nurses coping overall, in your estimation?
I think none of us were prepared for this. All hospitals in the US have emergency plans, and it's, they roll those plans, and it's in place and it's there. But I don't think any nurses were ready for this. It was unexpected. It was unlike anything we have ever dealt with. So I certainly wasn't prepared. I wasn't completely surprised that it happened after SARS, and when we had a preview that this might happen again. It's kind of overdue, just based on the history of when pandemics happen. So I think the majority of us were not prepared that it's going to happen in our lifetime.
How do you think that your colleagues are doing, either, in your profession, the things you read, or even people you know? It's been a long time now. We hear a lot about fatigue and burnout, and people leaving the profession. Maybe that's been a focus, of course, of reporting, because it seems pretty intuitive to us. But I wonder, from your perspective, how are nurses doing?
They're struggling. They are struggling, and especially the ones right on the front line. Not all nurses do the same jobs. So the people in the ICUs, the people on the COVID units, the people in the EDs, and it's not just the nurses, it's the whole team, the physicians, the respiratory therapists, speech pathologists, they are all struggling. And I think what really complicates us is when the vaccine became available. And initially, here in Washington State, it became available to healthcare workers at the end of December of 2020. And we knew that it is going to roll out and the general public would have that same access. And there was such a sense of hope. We all thought this is the beginning of the end. There was hope. And people just knew that, or thought that they had to work through this last bit. We're going to get there. And of course, then it didn't happen. because of the resistance to getting vaccinated, and because of the Delta strain that has such a higher impact than previous strains. So healthcare workers are tired. Some of them, they've lost hope. Some of them are angry, and it's understandable. There's anger and despair. And as you say, some leave, direct patient care because they just cannot deal with it anymore.
That anger, I wonder, I mean, we can't characterize it in a single way, but where does that come from? Does it come from just an overall accumulation of feeling that nurses aren't listened to, or is it more about the vaccination situation and people not getting vaccinated? I mean, where's that coming from?
I think it's basically the two things that I can think of is firstly the fact that we do have a solution. It's the vaccination, and yet people still refuse it. So people feel that we shouldn't be in this situation. It could have been solved. And then a second factor in the anger, I believe, is fear. Because, nurses and doctors and other healthcare workers go home to their families, to their young children who are not vaccinated. They have lived with this stress now since the beginning of the pandemic. And so the anger, I think, is partially a reflection of the fear that it's been a long time. And now we have a solution, but yet the solution isn't used, or isn't used by all.
Just a reminder, you're listening to COVID Calls, and I'm talking to Susan Skutta today, the founder of Young and Severely Affected by COVID-19. So let's turn to that. Susan, talk about Young and Severely Affected by COVID. What gave you the idea to start this project? What is it?
So initially, when the pandemic started, we saw on the news, these reports that young people are not at risk for severe disease. It's only the elderly, it's only people who are severely compromised, pre-existing conditions. And we also saw news reports of young people having big parties, pool parties, and other gatherings. And in my work, like many other healthcare workers, I believe, it soon became evident that although the majority of people who became severely ill or died were elderly, or they did have severe pre-existing conditions, there were many outliers, people in their 40s and 30s, and then we saw them in their 20s, who had no pre-existing conditions, or in some cases they had diabetes, which they didn't know they had, or they were obese, which we now know is one of the predisposing factors to becoming severely ill from COVID. And so this continuation of flooding the media, and I'm talking about the previous administration, with misinformation, misguidance, and reassurance, giving this continuous reassurance, which was false. And it made me very uneasy. And so I started searching. There must be somebody working on, the cases of these young people. I just want to share it on Facebook, and then my friends will share it, and, the word would spread. And I couldn't find any similar project. So initially, I just started searching for individual cases, and I would share them. And there were very few people who cared. And I understand it. At that time, everybody was already tired. And I'm talking about probably around May of 2020. People were tired of just hearing about COVID. So I decided to put it all together so that people can access it and maybe start putting faces to these younger people who became severely ill or died of COVID. Initially started a Facebook page, which I later figured out is not the best format, and changed to a Facebook page. And it grew very slowly. There was not a lot of response, but I felt I needed to continue. And what later became evident is that people, the families of some of these people who died, family members who'd message me and say, thank you for, memorializing them. And that wasn't even my intention at the beginning. But it made me aware of how important it is that, every one of these individuals, there's a story and there's a whole starburst of people around them influenced by this loss. And that's how it started.
Well, thank you for telling us about that. And there's so much in there I want to talk about. The first thing is just to go back to that period of time, April and May of 2020. And thank you for bringing us back to this moment in which it was a really steady flow of, I guess I want to be charitable and say it's misinformation. I think it became disinformation as well about the impact of COVID on young people. And as you framed it, that it was something that was out there, I guess on the one hand, to make sense of the fact that what we were mostly hearing about were people in long-term care, elders, older people who were getting it and dying, particularly in April. But as you point out, there were plenty of evidence that that was not the only thing. And so it was somehow, I guess if we're sympathetic about it, it was a story that we heard so that people wouldn't be as concerned for their own health if they were younger, or they wouldn't be as concerned for their children. When I'm feeling less charitable, I feel like that was really done in a deceitful way. And I don't know of any evidence that yet has been turned out about, the previous administration's strategy along those lines. But certainly by the end of the summer of last year, as we're moving towards a school year, that became strategic communication for the Trump administration, that kids have to go back to school and this disease doesn't affect them. And if you say otherwise, you're lying. I just found that so distressing. You had already been doing the project at that point for several months.
Correct. And, there was a period in 2020 that I went through so much anger about what I was seeing. Because, as you say, it wasn't just misinformation, it was disinformation. And what I found ironic is that that same mentality was seen initially in Wuhan with the Chinese government, where they tried they were not transparent. They were very concerned about social unrest, and they didn't want to disturb the economy. So it was downplayed until, it mushroomed and it exploded. And so the virus gets to America, and here we see exactly the same thing. Downplay, try to, retain the economic integrity, try to prevent chaos and, people becoming really panicked. Instead of informing people, this is bad. You're dealing with something that's really bad. What I find difficult at this point is that although there's still a clear indication that those who are against the vaccine, they are more people who are Republicans who are against the vaccine. And, I don't want to make that the focus. I'm always sort of walking on eggs because I want to address it that people need to be, they have to investigate their own backgrounds, their own belief systems, and see where they come from and how they have been influenced by their immediate society and by their religious leaders. And I don't want to offend people, but at the same time, I want them to look very closely at how this mindset that's influenced by culture and societal pressures and education and all those things, how it is impacting individual families and kids ending up without parents.
It's such a thoughtful approach, and I mean, just to underline the moment we're in as a society, that telling the truth about a health impact of a pandemic suddenly becomes a situation where you have to second guess yourself and ask if that's political.
Right.
That's distressing also.
Right. It should never have been about politics. It should have been about health. And yeah, that is distressful. And I think the best way for myself to look at it is when talking to people, is to remind them that many politicians, and I mean, this is a broad generalization, but politicians will tell you what you want to hear. Politicians are going to want to make you comfortable and, relax with them. Doctors in their everyday lives are the ones who tell patients, you have to stop drinking or you're going to die. They have to inform you, you have a new diagnosis of cancer. Your prognosis is this. It's not easy stuff, but it's the truth. And that is what people need to start realizing, is we need to focus on truth, not on feelings.
The other thing I found really fascinating in what you were describing, and I think I hadn't quite put this together in this way, is the challenge of health communication is real. It's every day. It's before the pandemic, and it will go on, because science is changing, and because medical best practices keep up with science. And in the middle of a pandemic, that's been fast moving. So this has often been pointed to in anti-vaccination circles, that, well, the government has changed its mind multiple times about masks, or they've changed their mind. I'm hearing this about booster shots now. Well, the government can't make up its mind about boosters, and so we can't trust anything they say. And I have to say, I mean, even back, last year when Trump was promoting the Operation Warp Speed, it cut across politics, at least for a brief period of time, in which people say, I think some who are more on the left said, well, if Trump is pushing this so fast, I'm not sure I can trust it.
Right.
So that's problematic. But the part of that is particularly comes back to your work, is I worry what's stuck in some people's minds early on is, oh, young people don't get this.
Exactly. And I was talking to my husband last night in preparation for this interview, and we were talking about why was it so hard to get past that point. And they basically took the Delta variant to start changing people's minds. And he brought up a very valid point, and it is that the initial message is the most powerful. People heard that, it was good to hear, it felt good, it was reassuring, and it stuck.
So just a reminder that you're listening to COVID Calls, and I'm talking to Susan Skutta today, the founder of Young and Severely Affected by COVID. So you mentioned that once you started to get some traction with the project, people started reaching out to you. I'm curious, I don't want you to give away all of your trade secrets, but I am curious how you actually go about doing the work. I've talked to Alex Goldstein about this on COVID Calls before, and for him, it's a lot of obituary searching, and then at some point, people started to contact him, and now I think that may be the way that he gets a lot of his profiles that he puts up on his site. How did you go about it?
My initial searches were basically also obituaries, news stories, GoFundMe stories, Facebook. And I still do a lot of that. But over time, more and more people have contacted me and sent me more stories, so much so that at the moment I sit with a backlog of emails and messages that I need to work through. And so that has changed. People have definitely become more involved.
When people reach out to you, can you characterize what that communication is like? How do they find you, and what do they hope to accomplish by reaching out to you, Susan?
Mostly it is members of the Facebook group who become aware of cases in their own communities, and then they will share it. There are a few cases where family members will contact me and ask to share it. So yeah, those are the two main ways.
And the terminology I find really interesting, severely affected. So you focus on death, certainly, but do you also focus on sufferers and long COVID? I mean, what falls into that category for you?
Right. Initially, my thoughts were to point out that there are quite a lot of people who, they develop blood clots, they end up having strokes, and their lives are changed forever. And many of these stories don't reach the news media. It's just out there. So I haven't focused a lot on just long-term COVID, but some of the cases that I want to share one specific case with you, which is just so tragic. This young boy, so his name is Daeshan Jameson. I don't know if you've heard of him. 10-year-old boy from Michigan. So Daeshan became severely ill with MIS-C, the multisystem inflammatory syndrome in children, which develops after COVID. And it is a rare condition, but it happens. It happens. And when it happens, it can be severe. So Daeshan ended up having both of his hands were amputated, both of his legs were amputated. And that's severely affected. So, people have to know it's not, sometimes death is a blessing. Death could be easier for some people than continuing to live with what they have. And I'm not inferring that that's the case of Daeshan, but many people end up being so severely disabled that it's not only death we need to be worried about. We need to be worried about long-term effects as well.
Oh, you shared Daeshan's case. There must be others along the way that have really brought you up short, or help us understand different dimensions of the tragedy. Could you share some of those with us?
Right. I think the one that I want to share first is that of Martin Addison. You might be familiar with Martin Addison's case. He was a 44-year-old speech pathologist, and he became ill and soon after died of COVID-19 in, I believe it was in April of 2020. So speech pathologists they are in people's faces. That is as close as you can get to a patient. And to me, Martin represents all the healthcare workers who we have lost in those early days, and now it still continues. And Martin's widow, Pamela Addison, has gone on. She is an advocate for COVID victims, widows, and their children. So yes, Martin's case will always stand out to me. Another one is Rawlinson Chicas. Rawlinson Chicas was a young man, I believe 35 years old, and our lives briefly intersected while I worked in mental health care in Dallas. Rawlinson had recovered from addiction, and he had become an advocate for treatment, and he would come to the hospital where I worked. He was a mentor for these patients who were on the path that he had been. And what was so incredible about him is he was this bulky guy, and he's black, and he had a lot of long hair, and he looked like a biker, but like a kind biker. And what was so interesting to me, oftentimes I would, just sort of observe his interaction with some of these patients. And what was incredible is that you could see hope in their eyes when he worked with them, when he talked with them. And that is something you don't often see in a psychiatric hospital, and he inspired me. And so part of his job was that when patients were ready to be discharged to their next destination, whether it's a halfway house or, I don't know, he would be the one to transport them, and he would remain in contact with them. So I believe Rawlinson affected a lot of people in the, Dallas-Fort Worth area. And when I saw his GoFundMe page, the first, it was like a gut punch. And I thought, I hope I'm wrong. I just hope I'm wrong. And I wasn't wrong. And so, and he is one of those unsung heroes. He was a drug addict, but he did so much. He turned that around, and he touched so many people's lives, and he's gone. He's gone. And he was also father of a young daughter. So, yes, that is a case that will forever stay with me.
When you talk about these stories, of course, we're not talking only about individuals. We're talking about families. That would be true, of course, of COVID victims of any age.
Right.
And so I don't want to say any death is more tragic than any other.
Absolutely not.
But when we're talking about maybe younger COVID sufferers, there will be a direct impact on a parent or on a child. And that's we talked a lot on COVID calls about the impact of this pandemic on children who are severely affected, not in their own health, but by the loss of a parent. So we have some tens of thousands now of children in America who have lost a parent or a primary caregiver, or have lost both parents.
Correct.
We're seeing that more and more. So that's another dimension of being severely affected, isn't it?
Absolutely. And, at one point I wanted to, in this project, get more, dig deeper into that, because in the end, the children are the ones that I think touch all of us, and who are most severely affected by losing parents. Suddenly, their whole life has changed. And that is why part of my decision, and when I started the project, I had to decide, but what is young? Mm-hmm. In where do you cut off? When are you not young anymore? And I'm definitely not implying that at 51 you're suddenly not young anymore. But
I'm glad to hear that. I'm really glad to hear that. I was wondering if you're going to put a number on the board, and I'm wondering where I'm going to fit in there. But okay, good.
So, in the end, I made the decision that I need to make some kind of cutoff. And I realized that there are many people in their 40s who still have young children at home who are dependent on them. In your 50s, for the majority of people, and again, it's just generalization. There's many cases that to who this doesn't apply. But in the age group of 15 upwards, there's far fewer people with young children dependent on them. And so that was part of, that was my biggest drive behind, I make the cut of 50 because I have to make it somewhere. It's the fact that these children, the children that remain.
You mentioned that people started reaching out to you, and now you have a more work than you can manage in terms of, the work you're doing with young and severely affected by COVID. And I hope you can catch up. I mean, the pace that we're on is a brutal pace, and doesn't seem to be relenting anytime soon. I see that as really great and positive reception to the work that you're doing if it's the families themselves that are reaching out to you. But we also live in complicated times. Have you received
Right.
criticism as well?
Oh, I have. I have received criticism, and I've received threats, which are unpleasant, but few. It's luckily not it's not a common occurrence. But I have received criticism, and I soon realized, this is going to be, I either need to stop the project completely or I need to learn how to cope with it. So that's what I've been doing.
What's your coping mechanism for something like that?
I respond to the people respectfully, like I would with any other person. And I usually apologize if I have offended them. If it is, a case where a family member has died, I will offer my condolences, and I mean it sincerely. It comes from my heart. And then I would move on.
It's hard for me to understand why someone would criticize you for shining light on the death of someone, particularly if it's publicly reported. Can you characterize that? Is it just a sort of general lashing out, or is it coming more from a sort of conspiracy kind of space? How do we understand that?
It's difficult to understand, especially if people have made public GoFundMe pages in which they, characterize it as having been COVID related, and where the majority of people, especially before the vaccine, people were in general grateful to get exposure, just for maybe somebody would contribute to the cause. So it is difficult to understand to me. But I think there are a lot of people, and it may be changing, but especially, I would say until about 2 months ago, there were a lot of people who wanted to not acknowledge COVID as the cause of the death of their loved one. It was just, they didn't want to acknowledge it.
So when you post it in the context of COVID, it somehow is jarring for people who are just not ready to acknowledge that.
Right. I think that is what it is. And what I find really sad about that is those who have lost loved ones who have refused the vaccine, but then the family comes out and say, the patient refused, or we didn't want it. We so wish we didn't make that decision. I have the greatest admiration for those people, because they are actually applying that terribly sad loss in service of society. They are preventing further loss of life. And to me, that is, I understand it must be very difficult to do, but I also believe it's the right thing to do, and I admire families and individuals who do that.
So just want to remind everyone that you're listening to COVID Calls, and I'm talking to Susan Skudda today, the founder of Young and Severely Affected by COVID. And Susan, we should give people an opportunity to know where they can find this group. Is primarily still a Facebook group. That's the main way to interact with the content you've pulled together.
It's on Facebook, and it's actually by the same name on Twitter. So they can find it either on Twitter or on Facebook.
Okay, so if you're looking to get to see the full collection of what Susan's been doing, go find that. And I think it's at Young and Severely Affected by COVID on Twitter.
Is it terrible that I don't even know by now? I just click my link.
No, it's not terrible at all. It's the reality of how much work you're doing that you're not taking the time to worry about that part of it. And I think if you go looking for it on Facebook, just with that title, Young and Severely Affected by COVID, you will find it there. And I've also linked to it on my Twitter account, so people can certainly find it there as well. If you just go to @US of Disaster, you'll find what Susan's been up to. So just want to stay with this just a little bit longer in terms of the community around this. And so, it's a Facebook group. It's functioning as a community, and a very special and unique one for these times. What is that community like? What do people get by participating in it? I mean, what does it do for them? And then what do they contribute?
I believe that a big driving force behind this is in specific areas where people have low vaccination rates, and the communities around them are resistant to getting the vaccine. And people are, they're trying to find supporting evidence to encourage their communities and their friends and their family to show them this is what's happening. This is what's happening right here in our little town. So I think that is a big part of it, is that people are trying to find information that's not always readily available, to enable, for all of us moving forward in this pandemic.
I think that's a really important detail. So people are finding this and then using it as a way to communicate with people they love, to try to show them that they need to get vaccinated.
Right. It's. I think that is at this stage probably one of the most important purposes that the group serves.
I think that's really important, because if people are keeping up with the news, or even if they're only haphazardly keeping up with the news, this population group up until very recently has not been featured. And if they're following the news closely, like if they're reading obituaries of COVID deaths, which I don't think most people do, you and I might be unique in that regard.
Right.
They're one here, one there. They still feel somehow like outliers. But when you begin to read them as a group and bring it together, then you see the many dimensions of it, I think.
I think you are absolutely right. This pandemic has, in a big part, the effects and the devastation has been hidden. It's hidden in the hospitals, in ICUs. It's hidden in homes where people are mourning. It's not as if we have apocalyptic people dying on the streets. It might have been a different effect, but it's a quiet pandemic, is what I want to call it. And that's what makes it so difficult for the information to get out. And that really makes me grateful for people who share the information and, contribute to this project and encourage others to, do what we all need to do.
Do you have some particular, quite specific goals with this work, Susan? I mean, I know early on your goal, you were very clear, it was to actually just make people conscious of the fact that this can affect people who are not just elderly. But we kind of know that by now, or we should know that societally by now. So I'm sort of curious how your goals have changed over time and what you're trying to achieve right now.
Right, and I can talk a long time about that, which I won't do. But at this time, I think that the two most important things to me are that, we're dealing with a lot of anger, understandable anger, as we've spoken about before. And I think the backlash that we see by vaccinated people against anti-vaxxers is doing much more harm than, coming from a place of caring and motivating people. So, and I don't know how I'm going to do this. I've been trying to, and I'll keep at it and try to figure it out. But we need to get to a place where we recognize that even though you're saying something on the internet, it hurts just as much. You cannot lash out to a family, even if their son or their daughter was a vocal anti-vaxxer, refuse to wear a mask. That family is still hurting. And by meanness and aggression, you're not going to change anything. And it's okay to express the anger and the fury in a different way, but I feel that we need to come to a place where we recognize that these are still our fellow citizens. These are fathers and mothers. Would you have said that about that person in 2019? No. And I understand there's some really stupid choices that were made. And it's choices that affect the entire community. But we cannot lose focus of we are dealing with our fellow human beings. And if in any way we can encourage them, continue to be supportive, and find ways to find common ground. That's what we need to do. So my hope is that we will get to a point where the anger can be converted in something more caring. I also hope that, and this is the second thing, that we can move away from what the misinformation that politicians bombard us with, and reinstall the trust that people used to have in doctors. The people who know, the people who have trained for this, who are used to telling you the truth, and it's very often a very uncomfortable truth. People need to start listening to what their doctors say. We need to get back to, and it's so basic. 20 years ago, the statement would have been crazy. People would have asked, what do you mean? We do listen to doctors. We need to get back to that. We need to get back to truth and evidence-based information.
Well, very well stated on the second one, and on the first point about sort of erosion of community. I would have thought, if you told me about this project in 2019, that this would have been the evidence of the coming together of people around death, particularly
Correct.
around young people.
Right.
And so that has also been an injury, I think, that people, certainly family members, have experienced it profoundly, I know, but even on the outside at a remove, to see the dissolution of societal caring. And it's not everywhere. In fact, it's probably a pretty small majority of people who'd be willing to lash out at a family or lash out at you. But they're amplified. They amplify themselves. They're very good at that. The media amplifies them.
Right.
And it does hurt. And I think that tending to community, what you said there, I think is really profound. The virus thrives on the fact that humans are social and that we live in community. So we may as well acknowledge that the virus is right in that sense and tend to that. And I think you've said it very well, and you've created a unique community here. What happens to this community when the pandemic becomes endemic? Will you keep doing this work?
I don't know. I don't know. I've been at points where I have been mentally exhausted, where I get to a point where, I just need to step away, just stop. But many of my other companions who do similar projects, you don't just step away. Initially you start doing it because you have a sense of responsibility. That you need to do something. And then once you're in it, you realize that you cannot just leave it. I hope that the situation will get to a point where I can make it less of a focus of my life. At the moment, I work full time, so I do this before work in the morning. And then after work, I take off about 2 hours, and then I start again. And it varies how much time I spend on it. But there's been very few days since I started this that I haven't touched it at all. So I hope I can, I don't know, get to a point where I can structure my life better and maybe reprioritize and focus on, as I said, we need to move towards encouragement and hope, and, a society that cares and promoting that. So long term, I don't have the answer for you, but I hope we get to a point where it will be better.
What are specific policies you'd like to see right now to help speed that along?
I feel uncertain about answering that. I know there's a resistance from people about mandated vaccination.
Right.
And again, I'm in that uneasy position of recognizing this concept of medical autonomy and autonomy in every sense.
Sure.
I think it would help if we had, a mandate. What I would really like to see is that within the nursing community, that nurses would come out and be more vocal about vaccination. What is being truly unsettling is, this is very local in areas that correspond to low vaccination, that you still find nurses and other healthcare workers who are not vaccinated.
Right.
And which I find extremely unsettling, especially because the American Nurses Association are, very clear about their stance on you need to get vaccinated. So we are seeing more hospitals and other healthcare facilities that are changing, that are requiring the workers to be vaccinated. I hope that becomes more universal, and that healthcare workers need to realize that what you carry out, and I'm not talking of the virus, your attitude, what you say on social media, there's a responsibility. We need to support the effort of getting back to a better life.
Well, almost up on time in my conversation today with Susan Skutta. I have one more question, Susan, and this is the question I ask for the historians in the crowd, which is, how will you be archiving this work? And I know you didn't start this to make a historical project. I mean, you're intervening in providing knowledge and hope for people and created a community.
Right.
But you've also created a quite unique archive of our time. And I wonder what your future plan is for that, and careful how you answer, because there's probably an army of graduate students out there right now who are thinking, wow, this is a project that I could really work on. There will be people out there who will want to preserve every aspect of what you've accomplished here. I mean, I count myself among them.
Oof. Maybe this shows my ignorance, but I haven't thought about that. I do not know. I recognize that it is important work, but I do not know. I don't have an answer for you.
No, I don't think that's ignorance at all. I think it's evidence that you're busy doing the work. Yeah. But I think it is archived already. I mean, in the places where you're putting it up, it's archived there on Twitter, and it's archived in Facebook. It's such a unique record of this moment, this time that we're going through. So, Susan, just any final things you wanted to say? Something we didn't get to that you wanted to mention, or anything you wanted to leave our listeners with?
I made a note, and maybe we already spoke about that. I think I already said what I wanted to say, but the big thing that I want to leave with is to keep encouraging people who are still not vaccinated, who have access and who are candidates for the vaccine, to get the vaccine. There's still a lot of people out there for various reasons who say they'll wait and see. We are way past the stage of having that luxury of waiting and seeing. We have seen. So, and this is coming from a place of kindness. I want people to get vaccinated for themselves and for their families. And again, I want to encourage people to get the information from their doctor. I want women who are pregnant or are planning to become pregnant. We are seeing a lot of young pregnant mothers dying at the moment who are unvaccinated. And, talk to your gynecologist or your ob-gyn. If they say you should not get vaccinated, maybe talk to another specialist, because the evidence is clear. These young mothers are at a severely high risk of severe adverse effects. And that is just a sad situation that needs to be addressed, and people need to know about that and encouraged to be vaccinated.
Just want to remind everyone you've been listening to COVID Calls, and you can catch COVID Calls most weekdays live at 6 p.m. Eastern Time. Today I've been talking with Susan Scudda, the founder of Young and Severely Affected by COVID. Susan, thanks for your work, and thanks for taking the time to share this, your insights into what you've been doing. And I know it's hard daily work, and I hope you'll keep doing it. Thanks for talking.
Thank you so much for the opportunity, Scott. I really appreciate it.
Stay healthy, everyone. We'll see you next time on COVID Calls.